Good afternoon, everyone. Are you able to listen to me? Hello? Hello? Can you please call Dr. Aisha Rajgopal? Okay. Thank you so much for inviting me to talk on the breast cancer awareness campaign that's going on. What I feel is it should not be restricted to just October. It should be for the whole year. But why these annotations, or why these kinds of um, awareness tagged to a month is probably a practice, is at least people are alert that such a campaign is going on, and they will make an effort dedicatedly in that particular month to spread the awareness of a particular concept, so that there are several things in the mind of an obstetrician gynecologist which needs to be addressed. So at least if you dedicate 1 month on a particular concept, this would go a long way in helping us to at least reduce the burden of the disease. So Aisha, you want to say something and then I can go on with the talk? Is this put on your auditorium, or how is this? Is this put on the screen?
Yes, ma'am.
So all of you are
Put on the
able to listen?
auditorium.
All
In the
right.
seminar room.
Okay. Fine. All right.
I
So
welcome you.
yeah.
My name is Dr. Yuti Rajan. She is obstetrician and gynecologist, consultant mirror health. Also a consultant in our college, government non-medical college in hospital. We welcome you, ma'am.
Sure. Thank you, Aisha. So today, do you have a dedicated gathering, is it, for breast cancer awareness in your college? Hello?
Yes, ma'am.
Okay.
Ma'am, we have, yeah. All postgraduates.
You
All
also have your
postgraduates and undergraduates.
Okay.
Final year BPMS, ma'am.
Okay. Your principal is also there, I think, no? Dr.
Okay.
Manjula?
Yeah, Dr. Manjula madam is on.
Okay. Hello, madam.
She's not well.
Good afternoon. Yeah.
Planning to organize in a big way. Yeah.
Okay.
On November 4th, ma'am.
Yeah, I didn't get you on Aisha.
Again, we are planning it in a big way on November 4th.
Okay.
So we'll have a session offline. Today, it will be an awareness program for 15 minutes, ma'am.
Yes, I got it. So what do you want to plan on the 4th of November?
Ma'am, a complete session for maybe for 45 minutes.
Okay, I'll discuss with you regarding it later. Okay. So
Yeah,
basically,
okay,
so basically we are aware that the current month, that is October, is considered to be dedicated to breast cancer awareness. And the slogan that is actually being passed over worldwide is Pink Together, Stronger Forever. So basically, we are aware that pink is a color that is associated with women. So basically, the pink ribbon is associated with breast cancer awareness. All right. So basically, what we want to do is, it is the unity, the strength that comes from unity for collective action. It's not that just the woman who's had this problem should fight this disease, but basically, it's a collective action where the entire society tries to help this woman fight this problem. So, this is the whole idea of spreading awareness about breast cancer, where we want the community to be actively involved. And that's how this slogan has evolved, which says Pink Together, Stronger Forever. Now, what you have to understand is, I think all of us are aware that breast cancer is currently the #1 killer amongst all cancers occurring in women. So it's a very, very scary proposition that, about 25.8 per 1 lakh women are afflicted with breast cancer, and the mortality could be as high as 12.7 per 1 lakh women. So almost like 50% of these women if not properly managed, could die. So this is preventable. So that is why we are actually talking about this. Now, I think this is an interactive session. Will you all be able to give me some of your inputs if I ask you certain questions so that it will make it more meaningful? Can I ask you certain questions so that I can take your point of view? Any of your postgraduates?
Yes, ma'am. Yes, sir.
Yes. So any
Yes,
of
ma'am.
your postgraduates, do you all agree that it is important for us to fight this problem because this is one of the number one killers of women in the country? Do you all agree?
Yes, ma'am. We agree to it, ma'am.
You agree. Okay. Now, what are the symptoms of breast cancer according to you? What is the age group? When do you think breast cancer is very common? Can somebody answer this?
More than 35 years.
Okay. Generally, what is seen is there is an upward trend in the incidence of breast cancer starting from 40 years. And it is usually, detected at around 50 years of age. That is usually the perimenopausal and the postmenopausal women. All right. That's the commonest occurrence. And what do you think are the symptoms of breast cancer? Can somebody answer this question?
Breast tenderness, discharge.
Any one of you, please enumerate. No mass answering, please.
Ma'am, breast tenderness, lumps,
Generally, we don't
discharge
say
from
tenderness.
the
What we say is whenever you encounter a new lump in the breast, yes, then there is thickening or swelling of a part of a breast. So there could be a lump which is newly formed, or there could be a thickening or swelling of a particular part of the breast, or there could be irritation or dimpling of skin. That means there can be some skin changes that you observe, which is like, suddenly it becomes dry or red or flaky skin in the nipple area. And sometimes you can also see that the nipple is pulled in a particular direction. Okay, and there is some pain in the nipple area. So these are some of the commonest symptoms, and many women are shy to even voice out that they've had these problems. Yes or no?
yes, ma'am.
And it's not just in the breast, but also in the armpit, because sometimes you can also have a lump in the armpit. So this is also something that you have to be careful about. So are we all aware about what are the commonest symptoms? So anytime anybody encounters a new lump or change in the skin texture or pulling up of the nipple and such kinds of problems and pain around the nipple area, you have to bring it to the notice of a clinician. Is that correct?
Yes, ma'am.
Yes, ma'am.
Okay. Now, what are the different steps by which we can detect breast cancer according to you?
Ma'am, examination.
What kinds of examination?
Inspection, palpation.
That is correct. But who should be doing it?
Self-breast examination.
Very good. Very good. So basically, the first step to identify any change that is maybe suspicious is by breast self-examination. Is that correct?
Yes, ma'am.
So basically, what we are supposed to be doing is to examine your breasts. I mean, all women are expected to examine their breasts at least when they're taking bath. And there is you can actually go and Google it on the YouTube. You will find it. So basically, what you're supposed to be doing is you're supposed to be examining the opposite breast. Like for instance, if you want to examine the left breast, you should use your right hand. And if you want to examine the right breast, you should use the left hand. All right. And usually you should palmar side of your fingers. And what generally is expected is there must be a circular motion, so that you rub over your breast to find out if there is any lump or new changes, isn't it? So this is something that you have to do meticulously. And this is also available on the internet. I mean, you can look at it, Google for it. There are beautiful pictures and you can do it. And it is very, very self-illustrative. And whenever somebody suspects something abnormal, then it is very important that you meet a doctor or a clinical clinician who can actually recheck this. And this is usually done by a healthcare professional who is trained to recognize. See, it is very important that this healthcare professional is trained to identify that, whatever you have been suspicious about, is clarified. So after that, the next important step generally is a mammogram. Okay. But generally, we don't do a mammogram in young women routinely, but after 40 years of age, like in some countries, like the United States, it's like recommended that you do it every year because it's very, very sensitive to pick up early stages of breast cancer. So there are 3 steps. One is breast self-examination, second is the clinical examination, and the third is the imaging, which is usually mammography, which is pretty confirmatory. Mammography works excellent. That's why we don't really use it generally as a routine screening technique in reproductive women less than 40 years of age. Is this clear? Is this clear?
Yes, ma'am.
Please repeat.
Yes. So shall we? Yeah. I did not hear. What is the question?
Ma'am, can you please repeat?
First step is breast self-examination. Second is the clinical examination by a trained professional. That is, if there is a suspicious lump, it has to be reconfirmed by a clinical examination, followed by an add-on imaging technique like mammography, which will help us to confirm the, the nature of the lump. Okay. It's a more confirming evidence. But make sure you don't do a breast self-examination during your menstrual period, because at that time, there can be some hormonal changes and you might not pick up the right finding. So it is not advisable. Okay. Shall I move on to the next concept?
Yes, ma'am.
Yes, ma'am.
Okay. So what are the different kinds of breast cancers that you're aware of generally? If we have to classify it generally, what are the different kinds of breast cancers? So generally we say there are 3 kinds. One is the localized one, where it is only localized to the breast tissue. Regional is outside the breast, but involving the lymph nodes, that is the axillary lymph nodes, etc. And distance is when it is actually gone beyond the breast. So it could have metastasis in the lungs and the brain and all that. So generally what they say is if you pick up a cancer, in the localized format, that is if you've picked it up very early, the 5-year survival rate, relative survival rate is about 99%. And if you've picked it up during the regional involvement, then it's about 86%. And if you've picked it up at a distant involvement, the 5-year survival rate could be as high as 30%. Okay, so this just tells us that there is a huge, survivability rate if it is picked up early, isn't it? Yes or no?
Yes, ma'am.
So you all agree that we have to be, prompt and educate our women to do these things so that, in case there's some abnormality, they can be picked up early and they can save their lives. Yes or no?
Yes, ma'am.
Okay. So what are the risk factors? Can somebody tell me what are the risk factors that, probably predisposed to breast cancer in our country?
Estrogen replacement therapy.
Okay. That is hormone replacement therapy. Okay.
Age, ma'am.
I'm asking, see, age, I know, but then what is so specific in our country?
Previous exposure to radiations.
Not necessarily
Family
radiation.
history.
Yeah, family history in some cancers,
Genetic.
taking hormones. There could be women who are nulliparous. That means who have not really conceived and given birth, who have not breastfed because they have unopposed estrogen. That is, the estrogen action is not opposed and they've not, had pregnancy. So progesterone has not actually come in between. So there's been an unopposed estrogen action. And also all these women who become metabolically obese, that means they are fat and they are not taking care of their metabolism. So these women are more prone because this obesity can predispose to a hyperestrogenic state, and also drinking alcohol. Okay. So we might find it, surprising that in our country, drinking alcohol is a risk factor. We see that a lot of women in the lower socioeconomic as well as in the higher socioeconomic status are prone for such addictions. They'll not reveal it, but that could be a reason. So these are the things. And what are the things when we are talking about risk factors? Are there factors which can help prevent breast cancer? Can someone answer this? How can you prevent
Breastfeeding.
breast cancer?
Breastfeeding.
Okay. For new mothers, breastfeeding, stay active. During the perimenopausal period, there is a high chance that you gain weight. So try to be involved in some physical exercises, good lifestyle, avoid stress and inflammatory stresses and those kinds of things. So all these things can help prevent breast cancer. Yes or no?
Yes, ma'am.
Yes, ma'am.
So I think it's all, see, we have talked about why we are worried about breast cancer, what is the incidence, why we are talking about breast cancer awareness today, and what are the different kinds of cancer, how do you detect cancer, what are the predisposing factors of cancer, and how do you actually try to prevent it? Yes or not? I
Yes,
wanted
ma'am.
it to be interactive so that you are actively involved and you also participate in the whole talk. It's not about a monologue where I'm just talking about the whole thing and you're just listening.
Okay, ma'am.
Okay.
Yes,
So
ma'am.
with this, I think we have briefly covered about the importance of what we should do actively to identify this cancer early, isn't it? So we all have to join hands and try to spread this message to as many women as possible, as many families as possible, so that we can probably contribute our bit to recognize this problem. And see, it's what the whole idea of this year is, to say that we will all fight it collectively. So it's not just about that lady, but the entire family and the society should support her to come out of this problem. That is why we are talking like this in a community, and we are trying to spread the awareness of breast cancer. So we are pink together and we will be stronger forever. Yes?
Yes, ma'am.
Okay. So I think with this, I conclude, and I'm just hoping that in a nutshell, you got some kind of information which is basic and which is relevant towards breast cancer and what we as a community can do actively to spread awareness. So thank you so much for the opportunity, Aisha, as well as Dr. Manjula from the Unani Medical College and all the postgraduates who have assembled here. I was not able to make up physically because I had some other commitment, but I think we have served this purpose of, talking with each other and interacting so that, we understand and we are convinced about the fact that we have to work towards spreading breast cancer awareness. Yes?
Yes, ma'am.
Okay. Yes, Aisha, is there anything else that you want me to
Ma'am,
talk?
why the month of October is chosen to celebrate breast cancer awareness?
There's nothing like that. There are several months, there is a mental health day, there is, cervical cancer awareness usually is in January. It is dedicated, that's all. There's nothing specific. According to me, it should not be just 1 month. But at least when we have a dedicated month, we are all going to work towards that cause, definitely. That's all.
Thank you, ma'am.
Ma'am, when is FNAC is done, ma'am? If mammography is already done, then when it is advisable?
It's not
FNAC.
like that. FNAC is see, mammography is different. It's
Couple-
imaging, right? FNAC is a confirmatory test. Ideally, what we do is we take out some sample from the breast tissue and send it for analysis. Okay, if it's a lump. And if in case that comes out to be, see, when there is a suspicious lump and when you know that clinically it is not invasive, but you want to check the nature of the lump, then we usually do a fine needle aspiration cytology. So there'll be a needle which will be inserted into the lump and aspirated. And then we study what is the nature of the tissue. And if it is suspicious, then radical action will be taken. But it has its own limitations. You can't do it on all kinds of lumps because sometimes, this FNAC also a skillful person should do it. You must be able to take it from all quadrants, otherwise you will miss it.
Okay, ma'am.
It's an invasive procedure. Mammography is not an invasive procedure, no? So only in a suspicious case you would do an FNAC. Mammography is a screening test where the entire population is subject to screening for breast cancer. Anything else that you want to ask me?
If a lady is having breast cancer, can she feed the baby, ma'am?
See, it all depends on what is the kind of breast cancer, what is the nature of breast cancer. Obviously, with if she's taking chemotherapy and those kinds of things, she may not be able to feed. She's being irradiated, she may not be able to feed. So generally, what happens is if we call it as pregnancy-associated breast cancer (PABC), which is identified during pregnancy, we cannot take an active measure at that time, to solve it. So at that point of time, most of these women are treated after delivery. In that situation, they are on chemoradiation. So in that situation, they'll not be able to breastfeed.
Ma'am, if breastfeeding mother is unaware of breast cancer, either it will spread to or transfer to baby.
See, generally these cancers are not infectious. Okay. So most of these women, especially the lactating women who are prone for ductal carcinomas, they present to us when they are breastfeeding only. So it does not spread to the baby. But what we are concerned is to the life of the woman because we have to define it as soon as possible and give, because they are all very invasive, especially the lactating cancers, no? The cancers that are identified during the puerperal period and when the woman is breastfeeding. They are ductal and they are very, very invasive. So it is important to pick it up as early as possible.
Okay, ma'am. Thank you.
Yeah. Anything else that you want to ask me? I'm very happy that your the postgraduates are asking these questions and they are coming out with some clarifications, which is very, very good. Anything else that you want to ask me? Okay. I'll call upon Aisha. Dr. Aisha, you want to ask me anything or can we close this? Dr. Aisha? Is Aisha Anjum there? Is Dr. Aisha around?
Yeah, yes, ma'am.
Yes, Dr.
Ma'am, for
Aisha. Is there anything else?
very informative, ma'am. You all are very thankful. Ma'am, we have
Your voice is not heard clearly, Aisha. Can you speak from your mobile or something?
Yeah.
Yeah. Yes, go ahead.
Ma'am, we are very thankful to you
Okay.
for this session
Thank you.
on that is awareness program on breast cancer.
Okay.
So we are planning to have a extended elaborative session on November 4th.
Which is November 4th.
November
Which
4th
day?
is Saturday, ma'am.
Okay. So what
Our
do
students
you...
have a lot more doubts.
Okay.
So if possible, it can be cleared on November 4th, ma'am. But for today, it was a very good session. We had so many questions which were answered by you.
Okay.
I'm very, really thankful to you, ma'am.
Sure. That's fine. November 4th, what is the time that you're having this thing?
Thank
And
you,
what
ma'am.
is
Thank
the
you so
format?
much.
Sure, sure. Thank you.
Okay.
Shall we log out? Shall I log out?
Yes, ma'am.
Nice to see the entire crowd there in the auditorium.
I'll send the pics, ma'am. I'll share the pics.
Yeah, yeah. I'm hoping that everyone was wearing pink today.
Yes, ma'am. We had planned to wear pink also, and all the PG scholars are wearing pink, ma'am. Pink.
Oh, very good. Okay. Sure. All right.
Okay,
Thank you.
okay, ma'am.
Please share
Bye.
the pictures. Bye. Yeah.
Yeah, yeah, sure.